Okay, here's everything that happened in medicine and healthcare today, and it's July 22nd. COVID-19 cases are once again on the rise in the United States. Now, the CDC hasn't released any official actual numbers of how many cases are being reported, but they do actually say that the general trend is an increase. They do say that this is relatively normal, as we've known for the last couple of years. The trend for COVID-19 is that it increases during the summer, and then it's not as bad during kind of the winter times. But they do say that the number of people showing up to the ER with COVID-like symptoms has been increasing as per usual. A new study is suggesting that our brains aged almost 6 months during the pandemic. Essentially what happened was they took a bunch of MRI scans of healthy individuals before the pandemic. Then they looked at them afterwards and said, what are the normal changes we expect to see over these few years, and how much has changed beyond that? They say that on average, each person aged about 5.5 months faster compared to what they normally see. So they think maybe the brain's aged by 5.5 months. Relatively interesting, but it's kind of a new trend as to how they're evaluating this. The most interesting part about the study was it didn't even matter if you actually got infected, meaning that individuals who weren't infected with COVID-19 still saw this age increase, meaning it had more to do with the pandemic, like social isolation and other stress. The Alice Walton School of Medicine, yes, Walton from Walmart, has officially opened up in Arkansas. It's going to have its first class, and the first 5 classes are going to have free tuition. It's a school that's not only stunning, but is trying to make a big change into how medicine is done by putting a focus on things like nutrition and gardening and having a better understanding as to how these roles play an impact in overall health. Lastly, there's a new director for the FDA Center for Drug Evaluation and Research. Dr. George Tidmarsh is going to be the director of it. He's currently an adjunct professor at Stanford. Some people like him because he's already published a bunch of educational materials as well as some medications himself, meaning he has some experience in the process. Some don't like it because he's been critical of the FDA in the past and say that he's going to be a little aggressive into how he roll back approval options for the FDA, but we'll have to see how it goes. If you want any specific information as to what we actually talked about today and what it means for healthcare moving forward, you can find it with the link in my Substack. There's the most up-to-date information with all the links to everything. If you just want a more in-depth analysis as to what we talked about today, there's some on the YouTube channel as well, but it's not as formal as the Substack. So I'll see you tomorrow for all the information again.